Hey, how's it going, everybody? Okay, it's a little bit past 10, actually. We're running a little late here. It's almost 20 after. I wound up falling asleep. We had a long night last night. It was kind of like up and down, up and down. So it's been intermittent, so we've both been sleeping. She's not sleeping, she's chilling. Her eyes open over there. But it's time to go ahead and do the 10 a.m. This one is going to be, let's get the better screen here. This one is the antibiotics. So we're doing the ceflexins. We're doing the 250 milligram and a 500 milligram. And these are both the 1 tablet each. I got them all set up here. I got all this set up before I started rolling. I'm going to do, and I already added in the grizzlies and the probiotics here. So that's already set up. So what I'm going to do here is I'm going to pop out a pill of each. These are each 1 tablet on this feeding. So that's the 200, or 250 I mean, and then this one here is the 500. So we got those all set. And then this is that bowl. It's like a soup bowl I was talking about during earlier when I was putting on the beard utility stuff. So, but what I'm going to do this time a little bit though is rather than, I'm going to kind of chop this up a little bit. Because last time, what I made this morning, that was a little bit more soupy because of the egg, and that kind of helped. So what I'm doing to make it a little bit easier for her, I think, she's just been kind of weird with the way she's chewing and stuff. I know she's kind of like had some hiccupy stuff going on. So I'm sure she's having some kind of indigestion problems. I cannot talk today for some reason. Okay, so I just put in the 250 there, and then we're putting in the 500. Just grab that out of the cap, putting that over here. So basically, this one is going to be pretty simple. Hopefully, she's ready to eat here. She's just kind of chilling. She hasn't moved really since the last time when I put on the beard balm for her skin to help it. She hasn't moved much since then. So let me go ahead and get in here. Let's remove this. And let's put this down where she can reach it. You ready to eat, baby? You ready to eat? You gotta take your pills for 10 o'clock. Come on. You don't want to eat now? Or are you just taking your time? There we go. Sometimes, usually, I mean, when she's herself, she'd have been scarfing that as soon as it got put down. But she's starting to lick it and stuff now. So, but part of the problem is the cone. I know she hates it. And that's why I'm feeding her with those little containers inside the cone because, like I said, her food bowl's over there. There's no way she can get her head in there to eat that. So this is the improvised way. But she definitely has to eat with the ceflexins. These are something that it's required with food. And since these are her antibiotics, I want to make sure that she gets these. The antibiotics, definitely important. We don't want infection. So we definitely got to stay on top of that. What I might do instead of, I got some doggy treats that she loves. I might try maybe putting those in next time instead of feeding her all this. The doggy treats, maybe, well, see, at 10 o'clock tonight, though, we got to give her these, and we have to give her pain meds and her sedatives. So we got to give her more pills tonight at 10, the next time her antibiotics are due. But I'll figure it out. But the next time she's going to get anything is going to be at 2. You're doing good, baby. You're getting there. So, we're doing something every few hours here. But, we'll look at the feeding or the pill schedule here in a little bit. But, other than that, she's kind of been chilling, which is good. It's what she needs to do. But I think a lot of that, too, I mean, she's taking sedatives and pain pills. And I know the sedatives, obviously, they sedate. So, and she needs to stay off that leg as much as possible, except for bathroom breaks and shifting around. But she's been pretty good. She's been a lot less restless this morning. Last night, she seemed to be a lot more agitated. every couple hours she was wanting to get up. She's been pretty much like this for probably about 4 hours now, 5 hours almost. So, as I fed her this morning at 6, after that feeding, she kind of moved around a little bit, but she's been pretty much I think this position is a little more comfortable because she's not on her surgical leg. She's off of it, so I think that's helping. And in fact, one of the things I'm going to do when she's done with this, the towel that she's kind of laying on, I've been using that to help elevate her foot, to kind of keep that leg up so that, there's some kind of airflow getting up in her. But as you can see, she's getting it all. So it took her a minute to kind of get it going, but she's still a little groggy. She's starting to come back to be, though, back to her more average personality. But I know these meds are kind of messing with her. You done with all that? Get those last few licks in. There you go. Good girl. She obviously got the pills. Now we're just licking the bottom. So that's good stuff, huh? Yeah, yummy, yummy. So it's funny because she gets them in a cone and starts looking at the cone. And then what I'm going to do, try to keep the camera on her so you got something to look at besides the messy room. And then we're going to give her some more water. She's been lapping up water like crazy when she gets it. But I know from like the sedation and all that from the surgery the other day, that makes you very dehydrated and stuff. Even though she got IV fluids, she didn't get a whole lot of water for a while there after the surgery. It was mostly IV fluids. And also, they stick tube down their throats and stuff when they're under sedation like that. And that irritates the throat. And, I'm sure that cool water helps, makes it feel a little bit better. But one of the things, as you can see, part of the cone issue is that it gets very wet in there. I'm going to move this under. Some of this water is spilling around and kind of coming down into the bed. So that oven mitt will help absorb it. But, the bowl seems to work a little bit better. I can put more water in it. I can tilt it better. So I think that, from now on, rather than using those little plastic bowls that I'm using the feeder with, I'm just going to use this as her water bowl. Let me fix this.